I'm Zac Greenberg, and we're here for Brain Food. Thank you, Dr. Barrett, for being here. And the Barrett Cancer Center is, what is it officially? Is it officially part of UC Health, or is it?
It is. Yeah. So the Barrett Cancer Center is really the ultimate in team. We have specialists from all the different areas, the surgeons, medical oncologists, radiation oncologists, diagnostic radiologists, pathologists, all working very closely together to try to render the best recommendations for particular patients with newly diagnosed cancers. And so it's an outpatient facility, and it's adjacent to the University of Cincinnati Medical Center, adjacent to the Neuroscience Center and the Medical Arts Building. And so we have patients that come in for daily radiation treatments, people come in for daily chemotherapy infusions and other systemic therapies. We see patients with newly diagnosed cancers to make recommendations on their treatment course. We see people who come for follow-up visits after having had treatment. And we have imaging, specifically around breast cancer imaging. So it's a great atmosphere here. We're very privileged to be able to try to help people as best we can with newly diagnosed cancers and people in follow-up.
Amazing. And so how has our modern times affected that? How has the COVID crisis, you do such a diverse and sounds like a lot of collaboration between a lot of artists and people, a lot of doctors and people of different, expertise. So how has the lockdown affected both, I guess, how the Barrett Center is able to operate on a higher level with the doctors, and also how patients have availability to that in the facilities?
Well, the patients, they're being treated actively for cancer. It hasn't changed too much. Patients are coming for daily radiation treatment, for instance, has not very much been interrupted. Same with people coming for infusions, for systemic therapies. Patients with newly diagnosed cancers are still being seen on schedule, some of those remotely, some of those by telehealth. Patients that are coming for routine follow-ups, if they don't have an acute problem going on, they mostly are deferring those appointments, or we're seeing people by telehealth. Fortunately, as far as the COVID disease goes, we've not seen very much here. Patients who have cancer potentially are more susceptible, particularly if patients are immunosuppressed. So we have been very, very careful. And fortunately, have seen very little COVID actually here. There has been a very big impact on visitors. Patients often, it's limited who can visit them. If they're in the hospital admitted, they often can't have visitors at all. Patients are coming for outpatient visits. Sometimes can have one visitor, sometimes can't. So that's been tough. It's been, it's hard enough being in the hospital for any medical procedure or illness, and then to be by yourself, that makes it a whole lot more difficult. And I do want to mention how grateful we are to you for the masks. You were able to get these masks to us at a time where we didn't have very many, and patients needed them, the professionals needed them, and that was a huge help. And I do have to say that we certainly do miss the music. We miss the art. It's so important for patients and their families to have that part of beauty in their lives, and people very much do miss it. And I would say that if there's any silver lining about all this, is it makes all of us appreciate how great more normal life is, and we're all anxious to get back to that, obviously.
Yeah, definitely. A couple of things in there. I know you mentioned, we were talking about how art is able to affect not only just the patients, but also the caregivers. And so, we have gotten to build a bit of a rapport with some of the nurses who I know really enjoy a little bit of break in the day. How has the crisis affected the integrated medicines program and being able to have that function in all of these releases and alternative medicine setups?
Well, unfortunately, there has been a bit of a break. And now integrated medicine is back. So acupuncture is restarted, massage therapy is restarted. But the emphasis on the whole person, unfortunately, has suffered through this whole crisis, and not having your music and having the other things that are so important to patients and their families. And I think that everybody was really just on the bare essentials that had to be done medically right now, as there's such an emphasis on not having too many people congregate, not having too many people around, concerns about the possibility of people bringing infection into the medical setting, into the hospital. So there has been a break, but we're all quite anxious to resume as soon as possible.
Yeah. And could you tell me a little bit about the new organization, the Cincinnati Cancer Advisors, and
Mm-hmm.
how that is, and also how that has that been affected more strongly, or Barrett Center has become kind of this pillar of the community there versus this is a much younger organization, and has it been much different trying to get that to adapt?
Well, Cincinnati Cancer Advisors is, I think, a novel concept. The idea that people can have a completely objective second opinion for their newly diagnosed cancer by someone who is not going to assume their care. So completely objective. There's no charge for it. It's really the only place in the country where somebody can come for a very high level consultation at no charge. And the way it works is that if a patient has a newly diagnosed cancer, they're mostly self-referred to this service. And prior to the patient being seen, as much information about the patient as possible is gathered. Then the physician and nurse who see the patient have as much time as they need to very carefully go through all aspects of the person's medical history, as well as their social history and things that are important to them. And then after the patient leaves, which may be a 2-hour visit, the physician and nurse have time to call people around the country that might have expertise for that particular problem, and then come back with an excellent recommendation. So that the tagline is that great care begins with a great plan. And it's so important with cancer from the outset to have a very strong plan in place. I mean, for many cancers, the first opportunity is the best opportunity of getting rid of the cancer. And as opposed to other second opinion services, which sometimes add confusion, particularly if somebody goes out of town, there may or may not be communication back with the home treating oncologist. There's expense and certainly difficulties with travel and hassles, and this is different. So this is an office in Cincinnati that's separate from the hospital. So it hasn't been there haven't been the concerns about the COVID so much with this, because it's very limited. It's typically one patient and perhaps they're the person close to them to come and see the physician and the nurse. And so it's a very small number of people that are together. They do wear masks. They do take all the precautions. The sanitation aspects have been very much emphasized, but it's been a safe thing to continue. So it's not been very much affected by the COVID crisis, fortunately. But it's a great service, and we've sent patient satisfaction surveys to all the patients that have been seen, and their satisfaction with the service is just over the top. Every single one of them rates it as high medical experience, if not higher, than they've ever experienced. And something else that's unique is that even though the patients are mostly self-referred, we've also now recently started sending surveys to the physicians who are involved in the patient's care. And a lot of times the physicians didn't even know their patient came for a second opinion. We've asked them about their impression of this service, and that has also been extremely positive, which is frankly unusual in the medical profession. You know, it's a competitive world out there. People compete for patients and such, and people have seen this as value added, and that's the goal. So when the physician sees a patient with this Cincinnati Cancer Advisors, they immediately communicate with the treating oncologist and are reassuring to them that they're part of the team, that they're not in any way trying to interfere with the relationship between the patient and the already treating physician. In fact, they're trying to increase the confidence of the patient in their treating oncologist. And then the oncologist, the physician, Cincinnati Cancer Advisors, provides their perspective on things that might be helpful to the treating oncologist, and the fact our treating physician has time to call around the country to look into the most recent studies, and they can easily provide that information to the oncologist. So it is very helpful, and those oncologists now have in their survey sent back how much they appreciate it. So it's a win-win all the way around.
Yeah, amazing. And it sounds like it's set up actually, one, for the facility, like you're saying, of being pretty small and limited, but it sounds like it's pretty set up for this situation, for the COVID situation in general, because it sounds like it's a lot of large connections between that you can communicate not, without needing to be in the same room to
That's right.
contact this network of doctors. Is it across the world or just across the country, or?
Actually, there have been some international connections with this. And so the physician is very well connected nationally, internationally, and knows experts on particular disease subsites of different places. And so he quickly calls them, and that's been mostly national, but around the country, and some international as well. And so the idea is to save so much legwork for a patient, and who may or may not know who to call another institution, or how valid the recommendation is. This is in a situation where the information can be assimilated and can be helpful to the patient and not competing. Because what so often happens is somebody goes to New York or Houston or Rochester or Cleveland for an opinion. And first of all, it's a hassle getting there. There's inconvenience of travel, there's expense. And then if they go multiple places, often they'll get multiple different opinions that don't necessarily coincide. And so the attempt here is to take any information and put it all together to come up with a cohesive plan that's best for this particular patient, and to provide this reassurance. And so it's really a tremendous service that really is unique nationwide. This doesn't exist anyplace else.
Yeah.
A high level opinion like this, no charge. And I do also want to emphasize that your masks were very helpful. The masks that you provided have been worn by the patients and physicians and nurses at the Society of Cancer Advisors.
Yeah, that's coming from the arts world, who operates a lot in the medical world. It's really interesting and great to hear that, because it seems like what I hear is that it's functioning a little more like again, organic art production, versus a medically, when we work and as artists working in the medical field, we definitely can find that it can be very boxy and competitive and all of the things that you're saying. And that unfortunately, it seems like at sometimes patients can be put behind that in certain circumstances, which I believe any amazing doctor would say is not right. So it's really awesome to see that you are able to set up this situation where really guaranteeing that the patient is what matters, right? And
exactly. That you hit the nail on the head. I mean, the overwhelming priority is the patient's perspective and what's best for them. And this whole Cincinnati Cancer Advisors is so immune to distractions that otherwise exist. There's no bureaucracy, there's no pre-certifications, there's no peer-to-peer reviews, there's none of the administrative distractions. And the spirit of it is just whatever is in the best interest of the patient. We don't want anything competitive between physicians or facilities. It's not about that at all.
Yeah. Well, amazing, Dr. Barrett. Again, thank you for being here.
Thank you.
Really appreciate it. You are, extremely busy, and I'm sure even more busy right now. So we really appreciate you taking some time to be here with us.
Thank you.
Provide some of this information for all of our viewers that I know a lot of it I didn't have, and it's very interesting, and I think speaks volumes to the medical field at large right now, and really helps some of us civilians wrap our head around what's going on, because there's just so much going on and you guys are so overwhelmed. And so it's really helpful to get a little bit of insight, especially to this part of, cancer treatment is something that can't just stop because something else starts. So it's really amazing to see how you guys have been able to adapt and really be able to find new ways to focus on the patient and overcome. So thank you again.
Thank you, Zach. And thanks for all your tremendous work. I tell you, the patients absolutely love the music. It makes such a difference. And it's one of those things that's it's difficult to quantify, but the feedback is just so positive, just adding that beauty to life, and makes all the difference in the world. We can't thank you enough for all your help.
Thank you. Yeah, and that's part of the interesting line that we tread, right, of working in both the arts and the medical field. It's like, there's a lot of our growth is not necessarily quantifiable, right, in our creation, versus medical field is, they're pretty polar opposites. So it's really amazing to see how they can come together.
Yeah, agreed.
Something else. So
Yeah.
again, thank you, Dr. Barrett.
Thank you, Zac.
Sue, I look forward to seeing you soon, to getting a drink when this is all over.
That sounds great. Thanks. Thanks so much. Thanks.
Have a great day, Dr. Barrett.
You too. Thanks, Zac.